Practical Nursing students. My name is Darlene Lepresto, and I am here today to show you a sterile, simple dressing change with a culture specimen. I have the supplies here. So we'll start down here. We have our tea sponge. Oh, sorry, Shaundi. I'm coming. We have our, how's that? We have our tea sponge, which we call pants. We have two 4x4s, which we may or may not use. Now in your skills checklist, I did not list that you have to use those, but we can if the wound seems to be draining quite a bit. We have our sterile saline. We have our blue pad and regular gloves. We have some fluffs, Curlex fluffs that we're going to clean the wound with. We have our measuring tape to measure the wound with. We have our culturette because we have to send a specimen down to the lab, and we have our biohazard bag to put it in. We have tape to secure the dressing. We have our large biohazard bag that we'll use to put the dirty dressings in. Two cotton tip applicators in case we need those. We have an ABD sponge, and I have my sterile gloves, and then a marker to put the date. Okay. So to begin this procedure, you would come in just like you always do and introduce yourself to the patient, do your GNAP, do your assessment. So we'll start. Good morning, Mr. Jones. My name is Darlene Lepresto. I'm a Jackson College nursing instructor, and I'm here to change the dressing on your belly. Before we get started, are you in any pain? And I'm going to use a scale, 0 being no pain, 10 being the worst possible pain. How would you rate your pain? 0 right now? Good, okay. Do you have any allergies? No? None that you know of? Okay. And do me a favor, I know we ask you this a lot, but will you just tell me your name and date of birth, please? Very good. Okay. Well, do you need to use the bathroom, do you think, before we get started? No? Okay. Because this will take probably 10-15 minutes at the most, and then by then it should be lunchtime, and then doctor will be in shortly as well. So we're going to go ahead and get started. So hand hygiene. And we're going to place the patient in the position that is most comfortable for you at a working height while maintaining safety. Now we want to provide some privacy for the patient as well. Mr. Jones, I'm just going to show your belly here. Now when you first look at the dressing, he'll have a dressing on from when they placed it before. So this dressing is dated in time for 8 o'clock yesterday morning. And we want to maintain, again, like I said, maintain some privacy here. I performed my hand hygiene, so I'm going to put my gloves on. And I'm going to put a blue pad here just to kind of have a working area and protect his linens. Okay. Now I'm going to spread out my biohazard bag because this is where I'm going to put all my soil dressings in. They are contaminated with possibly blood and body fluids. So we cuff it. Mr. Jones, can I use your legs as a table? Yeah, okay. You wouldn't want to do this on a confused patient. They'll kick it right off of there. So now we need to bring our supplies right up to where we can reach them. And remember the principles of asepsis. You don't want to turn your back on your sterile dressings or on your table that you're working with. You want it at a comfortable height. Okay. All right, I'm going to remove this dressing. The tape has been tabbed on the ends so that it doesn't hurt the patient when we're pulling them off. But just hold the skin down and then pull back. Just so you're not going to possibly give them a skin tear. And same on the other side. And as you're removing the dressing, and it's sticking to your finger, you want to observe for any drainage. and then discard. Okay, we have some 4x4s here we're going to take off. And then we have this tea drain. This is a Penrose drain. We can get a good shot of that. We have several different drains, and at the conclusion of this I will show you a couple of different drains that we have. We have a Hemovac and a JP drain, but this is a Penrose drain, so it's simply by gravity, and it's to help allow fluid that's accumulated after surgery to leave the cavity, the abdominal cavity. This patient also has sutures in, so we would want to count how many sutures are there and then assess the site for any redness, warmth, any signs of infection. He has 1, 2, 3, 4, 5, 6 sutures intact, so we would want to chart that and then chart all characteristics of the incision and then the Penrose drain as well. At this point in time, I'm going to measure the wound. So let's change our gloves, do hand hygiene. Okay. Now you want to measure the same either centimeters or inches, however the nursing staff have done before you. So his was done in centimeters before, so I'm going to do it in centimeters now. You just kind of hold it above. So we're measuring the actual incision, and he is 7 centimeters. Okay. So I'm going to be sure and document that along with my wound assessment. Now, I am ready to cleanse this wound, and so I'm going to get my sterile field ready, and we're going to cleanse the wound, and we're going to take a culture of it, and then we're going to go ahead and dress it. So, now our culture is sterile, so what I'm going to do is just open the tip of it. Maintaining sterility. I'm going to put it back here. I don't want to reach across it, but I'm going to put it there where I can get to it. Now remember, it's sterile. You have to be very careful about it. Here's my saline. This was opened yesterday morning, so we're still within the 24-hour time frame. It is 0.9% normal saline. That's what we want to use. It's not expired, so we're going to palm the container. I'm going to just move my cart or my table here a little bit. We're going to lip it. Okay. And I'm going to start opening some of my dressings. Remember, you're going to open them from front to back. Put them in order of how you're going to use them. We're going to dress the Penrose first. So we're going to put these, we call them pants because they have a slit in them. I'm going to set those aside. I don't think we're going to need them. We're going to do a 4x4. And then actually what I'm going to do, I'm going to open one 4x4, and then I'm going to have my assistant, when I'm ready in a minute, come and possibly open this and drop it on my field, though it's kind of tearing, so I don't even want to use that, because I'm afraid I'm going to touch the sterile dressing. So I think that I will just open the second dressing up. See, folks, it boogers up for us just like it does for you. I'm going to not touch that dressing. I'm just going to tear that paper. There. You got to be really careful of that. And again, if you need to throw it away and start over, throw away and start over. You do not want to contaminate it. Here's our ABD. I don't like that one. There we go. I was worried it was going to pop out. Okay. So once again, I'm going to lift my saline. I'm going to pour my saline on my Curlex fluffs. And just put that off to the side. Now I'm ready to glove up. How you doing, Mr. Jones? I know, the longest part is getting the table set up, and then we're ready to go. All right, now we did the sterile gloves in class on our first day. And for the sake of you watching me do this, I'm going to come across and I'm going to be right here on Mr. Jones's lap, just because I want you to watch me do this technique again. Normally I would open them on the table because I have room. Now, do you remember how much space or how many inches you have around the edge of this packet? Hopefully you're all saying 1 inch. 1 inch, that's what you have. Just open it real careful. You have that 1 inch. Take your time. You can kind of fluff it until you get it right. All right, so here I go. Dominant hand first, up above. I'm not turning my back to my sterile field. Okay, now sterile hand. Remember, you can hold that inch outside if you need to. Keep that hitchhiker thumb out in just a minute. Okay, hitchhiker thumb out. Okay, did I contaminate at all? No, my assistant says no, so I'm good to go. All right, I want to make sure I'm okay to go. I'm going to touch the center of this very carefully because it's still sterile. I'm just going to get it out of my way. All right, we're ready. Mr. Jones is very ready. All right, the first thing we're going to do is clean. Now, cleanest to dirtiest is how we clean. So, take a Curlex, and we're going to go right down the center of his incision and throw it away. Another one to the far side, throw away, and then where? The inside, right, closest to you. There you go. All right, that was cleanest. Now let's do dirtiest. Now I'm lucky because this Curlex Fluff package has 5 in, and that's exactly how many I need. I'm going to go around the pen rolls as carefully as I can. I don't really want to touch it with my glove because it's dirty. If you do, it's okay. Just remember that you won't be sterile with that hand anymore. Again, a circular motion. You're just cleaning the skin around it. Okay? We're done with that. Now we're ready to dress. So I'm going to go ahead and take the pants. That's what we call them. Oh yeah, I got a culture. Silly me. I'm still sterile. Put them back. This is sterile. The tips have remained sterile. I haven't crossed over them. And if you want, you can open these up and just lay it on your table as well if you wanted, but I liked to do it that way. Now these usually have a cap here, okay? So you have to break the cap. And the Q-tip on the end is sterile and the inside of the container is sterile. So we're going to take it and I'm going to contaminate my pinky and I'm going to just move that pen rolls out of the way because I want it out of the way so I can do my culture. All right, we're going to take the culture out and we're going to roll it side to side from top to bottom, and that's all we're done. We don't want to go back up and do it again, so just go slow, rolling the culture back and forth from the top of the incision to the bottom, and then we're done. Carefully place the tip of the culture into the tube without touching the sides. Secure it in, and then you activate the bottom, because that's the medium that will keep it fresh so that before it gets to the lab. And then we're going to send it down in a biohazard bag. We're going to put the patient's name, date of birth, location of where the wound was, all that pertinent information. You'll have a lab slip that goes down with it, and that needs to be delivered to the lab as soon as possible. So I'm just going to set this off to the side for now. I'm still sterile because I haven't touched anything else except my little pinky, right? So now I'm ready to do my pants. And I'm going to touch with this hand, and now that hand is not sterile, is it? Because I touched that dirty drain. So I'm staying with this hand, except for that pinky. And I'm going to go top to bottom. Now again, sometimes you don't need these extra 4x4s, and in your packet that you have, it's not on your list, so don't worry about it. But I'm just replacing it as if that was the doctor's order. Lastly, we have the ABD. You want to take the ABD by the middle, and you want to open it, and the sterile side is underneath, so I'm okay touching it here. You want to open it like that, and then you're going to come in and you're going to place it right down on the abdomen. All right? So now we are entirely covered. I'm going to remove my gloves. Hand hygiene. And we can tape this and date it. Mr. Jones, we are almost done. How would you rate your pain now? 0 to 10, 10 being the worst. A 1? Okay. I know messing around probably didn't help. Talk to your patients while you're doing this. Keep them informed. And even when you're in the skills lab, pretend it's a real patient and talk to them. That's the best way to learn. I'm going to put 3 strips on. I'm tabbing each end. Be sure you have your bandage scissors on you in case you need them. And then what do I need to do else with this dressing? Because once I get this last piece of tape on, there's something I need to do to let everybody know when this was put on. Right, date and time. Date, time, and initials. All right. Date, time, initials. All right. We want to clean up our mess. We're going to be sure that we go immediately to the chart and document, again, the wound, what it looked like, any drainage, the Penrose drain, any drainage there, the application of the dressing, the fact that you did the culture, and that you sent it to the lab in a timely fashion. And that concludes this video. Thank you.